Now recognize the gentleman from Georgia, Mr. Bishop, for 5 minutes of questioning.
Thank you very much, Mr. Chairman. Mr. Secretary, as you know, fuel and energy expenses are still at historic highs, and producers in Georgia's 2nd District are concerned with how the farm safety net will perform now that commodity prices are falling while input costs remain elevated. But 700 small businesses and ag producers have found relief through USDA's Rural Energy for America program, the REAP program, just last year alone. These energy efficiency improvements and renewable energy investments are helping farmers and business owners across rural America lower their energy costs. Can you talk about the impact of this program on operating margins for our farmers and our ranchers? And what about small business owners in rural areas like those in Georgia's 2nd Congressional District? The second question has to do with rural development, one of my top priorities. So thank you for highlighting the investments in water and sewer infrastructure in your testimony. You also recognize USDA's emergency rural health care grants as a program that's vital to helping rural communities maintain access to health care, with over 800 grants reaching more than 22 million people. Can you tell us what the administration has learned and what trends you've seen related to both infrastructure and in health care, and what suggestions or lessons you can share with Congress from the emergency rural health care grants that we can implement moving forward? Finally, Mr. Secretary, you identified the impact of potential cuts in our annual appropriations. If we're not able to enact full-year bills for FY24 at the levels in the bipartisan budget agreement, we could be looking at sequestration or a full-year continuing resolution. With such a tough environment, can you tell us what's at stake? The impact of sequestration to mothers and children who rely on USDA food assistance, to our farmers and our ranchers across the country, to our producers who rely on technical assistance from extension agencies, from NRCS, and to those who have housing and business loans with the USDA. And what about the impact of a full-year continuing resolution?
I'll try to respond to all three of those questions. On the REAP program, we've had over 5,000 grants awarded. Many of these grants not only reduce the cost to a producer or to a small business, but they also, for producers, create an income source. What's interesting about this is, a Rhode Island producer who's basically invested in a renewable energy program where he is selling excess energy on the grid. So it not only reduces his costs, but it also creates a new income source. We want to obviously see more of that. And again, it's voluntary. People can apply for it if they wish. And we're excited about the opportunity to see more grants in the future. On healthcare, listen, this is about basically continuing to invest in our community facility program and our telemedicine program. Our ability to basically help and assist small communities equip or build hospital complexes and or provide services, levels of services through telemedicine. These are two very popular programs. The emergency care program was funded through the pandemic assistance. To the extent that you want that to continue, that would require an additional appropriation. But in the meantime, at the very least, continue to fund the community facilities program, because that's a tremendously flexible opportunity. On the budget, yeah, I understand you. I'm getting the budget. I think I'm doing a pretty good job here, actually. On the budget, look, if you cut the budget, you have less services, you got less people. It's really that simple. You didn't expect me to be that quick.
What's the impact for a full-year continuing resolution or for sequestration?
Well, the problem with the continuing resolution, I mean, it's essentially the same, because you're not going to get, if you get a continuing resolution based on the debt ceiling deal, you're going to see a reduction in the overall budget. And so therefore you're going to see a reduction in services and a reduction in people. I mean, it's just that simple. We are operating right now at well, historically we've received less of the non-discretionary defense spending than many of the other agencies. So whenever we receive a reduction or a flatline budget, it really stresses things.
The backlog on SNAP applications in Georgia, the state's failing to meet the application processing timeliness requirements. I know that, can you commit to working with us to try to give states more flexibility, such as eliminating the face-to-face interview, to clear the backlog, and making backlogs more transparent to the applicants, so that they know that they may have to wait months in order to get their benefits?
With respect, that's not the answer. The answer is not to sacrifice integrity of the program. Those face-to-face interviews are very important. It's for the Georgia to use the resources they have available to have the staff adequately to run the program, and that's what we've asked Governor Kemp to do.
Thank you, Mr. Secretary.
The gentleman's time has expired.